COVID-19 has been declared a public health emergency of international concern, and the virus has now spread to many countries and territories. While a lot is still unknown about the virus that causes COVID-19, we do know that it is transmitted through direct contact with the respiratory droplets of an infected person. While COVID-19 continues to spread, it is important that communities take action to prevent further transmission, reduce the impact of the outbreak, and support control measures. The protection of child and educational facilities is particularly important. Precautions are necessary to prevent the potential spread of COVID-19 in school settings. However, care must also be taken to avoid stigmatizing students and staff who may have been exposed to the virus. It is important to remember that COVID-19 does not differentiate between borders, ethnicities, disability status, age, or gender. Education settings should continue to be welcoming, respectful, inclusive, and supportive environments to all. Measures taken by schools can prevent the entry and spread of COVID-19 by students and staff who may have been exposed to the virus, while minimizing disruption and protecting students and staff from discrimination. Today, children and young people are global citizens, powerful agents of change, and the next generation of caregivers, scientists, and doctors. Any crisis presents the opportunity to help them learn, cultivate compassion, and increase resilience while building a safer and more caring community. Having information and facts about COVID-19 will help diminish student fears and anxieties around the disease and support their ability to cope with any secondary impact in their lives. The purpose of it is to provide clear and actionable guidance for safe operations through the prevention, early detection, and control of COVID-19 in schools and other educational facilities. The guidance, while specific to countries that have already confirmed the transmission of COVID-19, is still relevant in all other contexts. Education can encourage students to become advocates for disease prevention and control at home and school and their community by talking to others about how to prevent the spread of viruses. COVID-19 is a new virus and we are still learning about how it affects children. We know it is possible for people of any age to be infected with the virus. But so far, there have been relatively few cases of COVID-19 reported among children. The virus can be fatal in cases, so far mainly among older people with pre-existing medical condition. So, now the latest fact. Understand basic information about coronavirus disease or COVID-19, including its symptoms, complications, how it is transmitted, and how to prevent transmission. Stay informed about COVID-19 through reputable sources such as UNICEF and WHO and National Health Ministry advisories. Be aware of fake information, myths that may circulate by word of mouth or online. Recognize the symptoms of COVID-19, coughing, fever, shortness of breath in your child. Seek medical advice by first calling your health facility provider and then take your child in. If advised, remember that symptoms of COVID-19 such as cough or fever can be similar to those of the flu or the common cold, which are a lot more common if your child is sick. Keep them home from school and notify the school of your child's absence and symptoms. Request reading and assignments so that student can continue learning while at home. Explain to your child what is happening in simple words and reassures them that they are safe. Keep children in school when healthy. If your children is not dis- displaying any symptoms such as a fever or couch, it's bet it's best to keep them in school unless a public health advisory or other relevant warning or official advice has been issued affecting your child's schools. Instead of keeping children out of school, teach them good hand and respiratory hygiene practices for school and elsewhere, like frequent and washing, covering a couch of sneeze with a flex elbow or tissue, then throwing away the tissue into a closed bin and not touching their eyes, mouth, or noses if they haven't properly washed their hands. Washing hands properly. Step 1. With hands with safe running water. Step 2. Apply enough soap to cover with hands. Step 3. Scrub all surface of the hands, including back of hands, between fingers and under nails for at least 20 seconds. Step 4. Rinse thoroughly with running water. Step 5. Dry hands with a clean, dry clothes, single-use towel or hand dryer as available. Wash your hands often, especially before and after eating, after blowing your nose, coughing, or sneezing. Going to the bathroom, toilet, latrines, and whenever your hands are visible dirty. Thank you and God bless.